You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, full mouth reconstruction for your mouth. My first guest, Dr. Howard, says that it's common that he sees patients that haven't been to the dentist in about 15 plus years and their mouth is a mess. And he says it's never too late to have the smile you've always wanted. Dr. Howard, welcome to the program.
Thank you, Randy. It's good to be here.
Pleasure having you on this show. Finally got you over here. Now, before we get into today's topic, tell me about your practice. I mean, what are the procedures you do? Who's your typical patient?
I'm a general dentist, so I have a general family practice. We see patients of all different ages, and we provide general dental care. However, the type of patient that I'm most known for is, as you mentioned, the dental train wreck.
So do they call themselves that sometimes, a wreck? Like, doctor, I'm a mess?
Yes, they'll refer to themselves as a wreck. We, of course, don't refer to them as a wreck, but they may need a whole variety of procedures that we provide. Anything from advanced oral surgery, dental implants. They may need one dental implant. They may need multiple implants. They need implants to support a denture or a partial denture. They may want implants to replace their teeth entirely. They have something like teeth in a day or all on four. We provide bone grafting to help support their jaw so that they can receive implants or just for a better cosmetic result. We provide crowns and veneers, cosmetic treatment. We also treat their periodontal disease, gum disease. They may have bleeding gums, loose teeth. We can treat these.
You use lasers as well?
We do. We
do.
For
these things?
We can use lasers, and we have non-surgical, non-invasive ways of treating periodontal disease these days that's very effective. It's faster and much more comfortable. We also provide crowns in a day, something called CERAC, which
is that right? So that's like a milling machine that's right there?
Correct. It's a computer-generated crown, no impressions, no gagging with impressions, no waiting with a temporary. They get the crown the same day. We provide that. We also have advanced imaging, a CT scan that allows us to diagnose more accurately. And we provide 6-month smiles, which is a fast track.
What is that?
It's a fast track orthodontic treatment for adults. And 6 months is the average time. Some people take a little less, some people take a little more. But
is that popular?
Very popular, very popular. People don't want to be in braces for a long time.
So you do fillings. I mean, you do all the standard
We do
stuff.
all the standard things too. Cleanings and fillings, root canals, we do it all.
That's very interesting because, I mean, the more, I interview some dentists, we interview medical doctors all over the country. And, it amazes me sometimes, I'm still surprised at the amount of education after dental school you guys go to. So let's talk a little bit about your background, your training. Because the other thing is, you said you wanted to be a dentist since you were 12 years old. You told me on the phone.
Yes, absolutely.
And I always think that's an odd thing that,
It was just, I was always on that track. I'm not really sure why, but it was always my passion. And I think that's why.
I mean, you don't know why? I mean, you were 12 years old going, I want to be a dentist?
I had a great dentist.
Okay.
I had a great dentist. I thought he always looked happy. He seemed to be enjoying what he did. I thought, man, I want to do that too.
All right.
And I think it's because of that passion. I mean, frequently patients will say to me, why are you so darn happy? People will actually come in and they almost seem frustrated.
So you're always like this?
Yes.
So you
I enjoy being at the office. I love what I do. And because of that, I have a passion for learning new procedures, new techniques. So I do quite a bit of continuing education. Matter of fact, I've taken hundreds. I'm approaching actually thousands of hours of dental education.
Is there really that much to learn?
There's constantly something new to learn.
Really?
So, yes.
Okay, so let's start with defining what full mouth, today's topic, full mouth reconstruction is. What is it? I mean, what are the categories?
Full mouth reconstruction, first of all, no one comes in and says, I want full mouth reconstruction. What they want is the solution to their problems. They know what their problems are, but they don't know what they need. Full mouth reconstruction involves all the different modalities that we offer in dentistry. It involves surgery, non-surgery, it involves crowns, implants. It involves all the different types of treatment that you can get, but it's done in one situation, one location by one doctor, and it allows for a more comprehensive and efficient way of doing treatment.
Now, giving us a little bit of the inside scoop, I mean, researching this whole full mouth reconstruction, I think, and even asking my circle of friends, that the perception is pretty much dentist is a general dentist is a general dentist, but not everybody does full mouth reconstruction.
That's true.
I mean, is that right?
That is safe to say. Filling or fixing one or several teeth is not a big deal, but once we start to completely rehabilitate someone's mouth, that requires quite a bit of training. Any dentist may be able to do it, they just may not feel comfortable doing it when we completely change every aspect of their mouth.
So what are the categories then of these patients, if you had to put them into a category?
Some of these people are people who are just very unhappy with their appearance. They put up with their appearance for many years. They walk around with their hands over their mouth when they smile or when they talk. They just want to have a new look. Other people are in pain. They're uncomfortable on a daily basis.
Is that common, by the way, pain?
Very common, very common. They'll avoid foods that cause pain. They may just suffer with the pain on a regular basis.
It hurts to chew. When you say pain, what do you mean?
It hurts to chew. Sometimes it just hurts all the time. And once they get to a certain point, they may go have one tooth removed, but then later on, the same cycle repeats itself, and these people are just tired of it. They're tired of living with pain. Okay. Other people are too busy. They have very busy lives, and they may not be in pain all the time, but they're frustrated with what their condition is, and they just haven't had a chance to do it.
So do they actually say that? They're too busy? That's
exactly.
why?
Absolutely. They may have been pursuing a career that just did not allow them to take the time to treat themselves. And they may also have a perception that it can't be done, that it's going to require multiple visits, and they may have to go to the dentist every week for months and months. When in fact, very often we can complete a major transformation in one visit. Very often, one visit, one morning, one long afternoon in our office.
Is that because of IV sedation?
Absolutely. IV sedation is a big part of that. They come in.
So you do IV?
I do IV sedation. We also do oral sedation, but
okay.
IV sedation also.
Okay, so you do. Is that popular, by the way?
Very.
On a lot of these procedures?
Absolutely. They may be busy and they need it all done in one visit, or they may be very apprehensive and the fear has kept them away from it. And in a very comfortable and controlled manner, we can provide a large amount of work in one visit.
You know, I thought it was very funny. We're talking over there in the green room and you say, you know, Randy, I hear all the time, Doctor, I bet this is the worst you've ever seen.
I hear that all the time.
Is
Absolutely.
That right?
And they may be right in the sense that it's the worst they've ever seen, because they don't realize that there are people just like themselves that are walking around every day, but they're just very good at hiding it.
They just hide it.
They hide it. And
can you spot a hider? Like they walk in on the consult? I mean, could you spot it in a way?
Without a doubt, without a doubt. These people do not speak normally. They cover their laugh or their smile with their mouth. They may avoid eating in certain social situations. And yes, it's easy to pick up on.
Now, you know, you're a dentist, and I say this to all the dentists that come on my show, but I'd like to hear your take. Because I always think sometimes, you know, you're a dentist, that's why you think the smile is important. So how important is the smile, in your opinion?
Smile is huge. It's absolutely a major part of our lives. Now, we can look at the health aspects of it. From a health standpoint, there are more and more studies all the time that show that dental health is very closely related to cardiac health, diabetes, respiratory health, but the biggest factor is self-confidence. It's amazing what parts of their lives people will put off because of a lack of confidence, a lack of feeling at ease in social situations. And whenever we restore their mouth, their confidence comes back, they become more outgoing, sometimes they start dating again.
Do you see transformations like this? Like you fix their teeth and all of a sudden everything changes?
Absolutely. They are not the same person anymore. Sometimes it's a spouse and their wife will come back and tell me that you won't believe my husband now. He would always sit in the corner in a party. He would never speak, and now I can't get him to stop talking. And
really?
Absolutely. Very often the spouse will talk about the transformation. Other times it's the patient themselves. They didn't date for years and years. They really thought about going out, but they were embarrassed of their smile. They were embarrassed of being able to even eat on a date. And then once we've completed their full mouth rehabilitation, they're in the social scene. Matter of fact, I have a patient who took up ballroom dancing and has
because of their teeth.
Because of their teeth. She always liked dancing, but she gave it up for years. And then once she got her smile back, she started going into ballroom dancing, and now she dances probably 3 years.
Do they confide in you these things in the on the consults? Like, you know, this is what's going on?
It usually doesn't come out initially, but as we start to get to know them better and really find out what their major concern is, and that's something that we really try to do. Everyone has a different reason for pursuing this, and it's their specific concern, their tipping point that has pushed them over the edge that we really want to help them achieve. So we try and get to know our patients very well and find out what's most important to them. You
brought photos of these full mouth reconstruction.
This is one example of a patient that I saw who very fit, very attractive guy with an excellent job, but he was hiding things. He was afraid to smile, and he was also going through a lot of tooth pain. He was constantly suffering with toothaches every time he ate, and it was very frustrating to him and to his wife. He wouldn't go out to dinner because he couldn't eat comfortably. And this is a case where we pretty much had to, over a period of time, restore his mouth completely.
Now, when you look at that on the consult, do you kind of feel like I know what's going on and this is going to be a great, you know, result?
I do. However, I don't know yet what he really wants and where he wants to go. So we start to try and bring out his concerns, the type of past problems, what kind of things has he avoided, what kind of effect has it had on his personal life.
Why the pain, by the way? What was going on with the pain?
Toothaches due to cavities that had caused the tooth to die and needed to be extracted. And difficulty also because of the wear. The heavy wear on his teeth was causing nerve exposure and sensitivity. This is a good example of what's called bruxism, or heavy wear, just the effect of grinding the teeth.
They're almost like chipped. I mean, when I look at those two front teeth.
They're heavily worn. He's lost probably almost half of the length of his teeth. These teeth should actually be considerably longer than the teeth that are adjacent to him, but they're worn down and very sensitive. It caused pain every time he would bite into food that was hot or too cold. So this is the type of thing that we see on a regular basis and that we can fix with full mouth rehabilitation.
So what does he say? I just want everything?
He did. He wanted everything. This is one that said, yes, I want the smile. I want the Hollywood smile.
Okay.
And we were able to give him what he wanted in a very efficient and comfortable way.
Take a look at that after. Interesting. Wow, and that's complete transformation.
Complete transformation. The after effect, I think, shows the vitality of his personality, his health. He's an extremely fit person, very outgoing, but he wasn't showing that whenever he was living with this situation.
So that's like a full mouth case. I mean, this guy needed extractions, implants, cosmetic stuff.
He even had braces to help align the teeth so that we could restore them in a more ideal situation. And this allowed us to get the youthful and cosmetic look that we got. When we finished this treatment, and we finished it much faster than he ever thought we could, he gave me a hug. He was just, he was truly, he's a soccer coach, and he is extremely outgoing, and whenever I see him on the soccer field, he still shows off his smile almost a year later. So this is a great example of the kind of effect it can have, not only on him, but on the perception of other people. You look at this mouth, you think worn, haggard, older, and you look at that smiling face, and there's a very vibrant, outgoing person. Completely different situation.
That's true. When you see the before and after, yeah. I mean, he's sophisticated now, you know? And those look like his real teeth.
Yes.
That's pretty good work there, right?
Right, right. And
I'm trying not to side with you, by the way, but this, it does look good. I mean, I think anybody at home could take a look and say, you know, I guess the smile is pretty important, but it doesn't hurt anymore.
No, it does not. He is completely comfortable in chewing. He goes out, he can eat anything he wants to eat, and this is going to last him for a very long time.
Do you see him act differently on these follow-up visits?
Absolutely.
Like what?
I see him, and I may look at that, and from a technical standpoint, I'm very happy and proud of the outcome, but what I'm most proud of is how he feels. He cannot stop talking about it. He's beaming from ear to ear. He has a gorgeous smile, as you can see, and that's how he looks all the time.
So these people, I said at the top of the show that 15 years they haven't been to the dentist. 18 years they haven't been to the dentist. Is that true?
That's very true. Many of these people have put it off for far longer than you would believe. And for whatever reason, they finally reached that point. Maybe they didn't realize there was something that could be done. And they make the decision that enough is enough, and I'm going to do something about it.
So you can inch them along as well. I mean, it doesn't have to be really expensive.
No, it doesn't have to be. Very often we put people on a multi-year plan. The important thing, once again, is to find out what they want.
What do you mean multi-year plan? Tell me about that.
Well, some people come in and they want it all done at once. Other people want just one issue taken care of, and we take care of a cavity and get them out of pain. We make their teeth whiter, and suddenly they have concerns about other things. They want to chew better. They want their teeth to last them a lifetime. And suddenly we start to develop a plan that lets them get to where they want to be, whether that's in 6 months or 3 or 4 or 5 years.
Is there a certain kind of patient on this full mouth reconstruction that you'd like to see more of?
Absolutely.
In your practice?
It's the person who's suffering silently, who's been putting up with this for years, and they just don't realize there is something that can be done. When we look at the next photo, you'll see somebody who had really not known that there was something he could do, and he said he would have done something years ago if he'd only known. But when he came in, he really wasn't sure what could be done. And once he realized, we moved ahead.
Let's take a look. I mean, that looks pretty bad from here, by the way. I'm sorry to laugh, by the way, not to be insensitive. I'm just saying this is really a bad one.
This was a bad situation. He was in considerable pain.
Well, that's got to be unusual, this one.
Actually, you'd be surprised how well he was at hiding that. His mustache was actually longer than that when he first came in. You can hide it with facial hair. You can hide it with the fact that you don't speak loudly. You cover your face when you smile or laugh, or you just don't go out in public.
What's going on there, by the way?
Well, this is a situation where obviously there were teeth that were not salvageable. Several of these teeth had to be removed. Other teeth we could salvage through the use of laser periodontal treatment, gum treatments that were not invasive, fillings, crowns, veneers. There are dental implants to replace the missing teeth. There was some bone grafting to restore the proper size and shape of his smile. And now look at this after. There's a huge difference.
Very nice.
Absolutely, a great result, and you can see it in his smile. He smiles broadly, he smiles easily. He's a business owner, and his interactions with his clients have improved greatly, and I'm sure he's certainly more confident and certainly happier about every aspect of his life.
So with this, you know, as they call it, full mouth reconstruction, I mean, when you talk to them, how many years did they, put it off, or were they aware that they had a problem?
They may have been aware that they have a problem, but the problems would slowly build. Some of these problems can be painful. Other problems progress slowly without them knowing. And in his situation, probably he'd been putting it off for 10 years or more. He's a great example of what happens very often with these patients. Not only is he more confident, but now he has a greater investment in the health of his mouth for the rest of his life. He's now flossing, he comes in regularly, he's happy to come in and have routine dental care, so he doesn't ever have to go through that again. It's completely changed his outlook.
They start taking their mouth seriously, I guess.
Absolutely.
They don't want that to happen again.
Exactly.
So they tell you they never flossed before? Like on that before?
Rarely, if ever, floss. And now he's very meticulous about his care.
I talked to, and I told you this in the green room, I said, I had a friend from Nevada, and he was going, Randy, I don't like these full mouth, these tough cases.
Yeah.
Why do you like it, though? I mean, because when you see a guy with his mouth is completely broken down, you know, where's your satisfaction there?
It's the technical part. I love the challenge of the technical part, but also the result. I mean, these people, you know, they're friends, you know, they're patients for life, and some of them become very good friends even.
Is that where you get most of your, mostly referrals?
Mostly referrals,
from each other?
Yeah.
It's a tough economy, okay? You want to present yourself in the best way you know how. Do you see that in a tough economy, people actually investing in their smile?
Absolutely.
Because of work, because of their career?
Absolutely. And there's definitely some statistics and numbers to back that up too, that a smile is one of the first things that we notice. It conveys a sense of power and authority and confidence, and these people do better in the workforce. And in today's economy, every little advantage that you can get helps.
Now, these full mouth reconstructions, as you call it, what are the age ranges of people you see? Is it more men than women, more women than men?
It's pretty evenly split between men and women. The age range tends to be age 40 and over, although there are some people who are much younger. You'd be surprised, who have done situations like this case where he's definitely in his 30s. So here's another example. Here's a woman who is only 65, but she feels much older because of the effect of her teeth and the effect it's having on her face. She came in and she complained that she can't see her lower teeth anymore. Many of her lower teeth were missing, but she was most importantly missing a lot of bone due to gum disease and other missing teeth and a poor fitting partial denture that allowed her face to have that sunken in appearance. You can see, you can barely see a lower lip. It's just a thin line. It's also straight across. It doesn't have that nice attractive curve of the smile that we want. The upper teeth were also painful. She couldn't bite into things the way she wanted to. And so she had multiple things going on, and we were able to go in and treat her with a variety of different things, from bone grafting to help bring out her lower lip.
So the bone grafting, we're not talking about from the hip or anything like that. I mean, these
not
are synthetic
typically.
materials?
There are synthetic materials. There's also natural human donor bone that we can use, and we sometimes will take bone from them. We can take bone from a different part of their jaw or their chin, wherever it's needed. But this was a combination that we used bone from a donor, and we were able to rebuild her chin so that it could support the implant, so it could support her lip and give her a more natural and youthful appearance. Take a look at these two pictures. Look at the effect of the before versus the after. Look at the lip line. You can barely see any lip. Here in the after picture, you can see the nice full support.
It's like a smile.
The curvature, right.
That's from what? Adding bone here?
That's from adding bone and putting teeth in the proper position. It restores that youthful appearance. You can see that nice curvature, the nice display of the teeth.
Now, to other dentists, by the way, is this impressive? I think when they see this, because it's pretty interesting actually how she. The other thing because I'm sitting here going, you know, what's making her look so much younger? But it's like you say, that lower lip gave her kind of a feminine.
Once we rebuild the support and put the teeth where they need to be, then the facial characteristics follow. You can really see that nice feminine curve to her lips and to her smile, and that's the kind of result we'll get routinely.
Full mouth reconstruction.
Absolutely.
But they don't ask for that. They just come in and say,
they want the result.
I want help. I want help.
That's
okay,
right.
You have other photos. What are we looking at?
Yes, here's another picture of a case where we had a lot of decay. You would have no idea that this woman is a very successful, attractive, outgoing woman.
Interesting. It's a
but
woman.
This is what she hides. The teeth are worn down, they're decayed, several are missing, and she needed pretty much the full mouth reconstruction, which we were able to do.
Okay, okay.
Here's a picture of the after, and you can see by the nice broad smile on her face, the nice straight teeth, we have a combination of crowns, dental implants, bridge work, there is regular fillings, there was some laser periodontal treatment. This woman now has something that she can really be proud of. She's even more outgoing, even more gregarious than she was before, and she's extremely happy with the result.
Okay, so are her dental, I mean, for the most part, as long as she takes care of it, her dental problems are kind of behind her?
She's stable, she's healthy, she needs to take care of them, but she's very motivated to take care of them, and that should last her.
So you had to remove some of these teeth. I mean, on this before, I mean, there was a lot going on.
We removed several of those teeth, and then we did bone grafting and dental implants, but we were able to save a lot of those teeth and restore them and bring them back to their more natural appearance.
Okay.
And here's another case. This is another case where we have someone who had what he called a snaggle tooth and a darkly discolored tooth. He also was missing several teeth. He was in a lot of pain. He actually couldn't chew very well because most of his back teeth are actually missing. He only had a few teeth. And one of his biggest concerns is he didn't want a denture. His grandfather had a denture, and he didn't want to feel like his grandfather. And so he wanted to explore some options as far as keeping his teeth and replacing the missing teeth. And I think you'll see at the result, he didn't want the Hollywood smile. He wanted to look natural. He wanted to look healthy. He wanted some colors and a shape of teeth that was age appropriate. He feels good because he knows he's not going to have to go to a denture. He knows that he's going to be able to chew foods that he wants to.
You say age appropriate. What do you mean by that?
Well, he didn't want the paper white Hollywood smile that some people do. Some patients love that. Other people want a little bit darker smile. They want to look like they've never had any dental work.
Yeah, if you saw him walking down the street, well, actually he has perfect teeth though.
He does.
He has beautiful smile.
He does have perfect teeth now. But still, we tried to keep the shade of the teeth more appropriate for his age, and that's exactly what he wanted.
So on the before, because I'm not straight, so you had to pull some of those out? I mean, those teeth had to go? All the front teeth?
Correct.
Those were like just hanging on for dear life?
Most of the front teeth had to go. We were able to remove those and do some bone grafting and dental implants. We were able to save some of the back teeth and preserve some of his natural bite, and the combination was a result that is healthy and attractive and gives him the healthy outlook that he wanted.
So he wasn't smiling before?
He wasn't smiling nearly as much.
I mean, so you fix their smile, and I mean, do they get compliments?
They get compliments all the time. For him, peace of mind was his big thing.
Okay.
He did not want that fear of a denture looming over him all his life, and there was a feeling that that denture was going to make him feel old and unhealthy. And now he knows he's going to be able to keep what he has for the rest of his life, and he is very happy with the result.
Okay, so he thought he was going to have to get a denture.
Yes.
Are there a lot of people like that?
A lot of people
they don't know their options?
Exactly. A lot of people just assume, I have a bad tooth, I have a toothache, I must be in bad shape, I'm going to have a denture. They don't realize there's lots of different options, and that the way we can provide treatment these days eliminates the denture if you want to eliminate a denture.
Okay, again, I got to mention, because, I do a lot of research. I mean, I've talked to a lot of dentists all over. I mean, you have under one roof, again, this is a real interview for people just tuning in. I'm not siding with you, but from this machine that that makes teeth in a day, right?
Yes.
CEREC machine. You have lasers. You have your own CT scanner.
Correct.
I mean, was that the plan going into this, that they didn't have to go anywhere else?
That was the plan. I built a...
And are you qualified to do all of those things?
I am. Because of my training, I am qualified to provide all these services. And when I first built my office, I wanted it to be a state-of-the-art center where I could provide all this treatment in one location in a very comfortable way for patients. I wanted patients to feel like they were in control and that I was in control of the result, and they didn't have to be sent off to different offices and there would be delays in treatment. This way we have everything they need, from lasers to CT scans to advanced bone grafting materials. We even do accelerated braces if they need it. So they can receive this all in one place. But the most important thing I probably have in my office is my staff and my team. They're wonderful people to work with. They're extremely knowledgeable and dedicated, and they are the ones that help me find out what people really want. They connect with the people on an individual basis, find out what their needs and concerns are, what their personal story is, and I think that's why we're able to get the result that patients want.
On all of these, I mean, you showed me some dramatic stuff. I mean, you know, if we kind of could flash a few of these before and afters, were any of these told, I'm sorry, there's nothing that can be done, you have to get all of these teeth extracted, you got to go to a denture?
Yes.
Really?
Many times we're the end of the line. They've been to numerous offices, they've been to numerous dentists, and they've been told they had to go to different offices and that multiple different opinions, and they just
like
weren't
a specialist here, a specialist there?
Exactly, exactly. And they just didn't like what they had to hear. And for whatever reason, they heard it through word of mouth. They maybe saw another one of my patients that had a good result, and they finally came in and say, this is it.
Are they frustrated by the way that, I mean, that's got to be frustrating if they're told nothing can be done.
Extremely frustrated. And very often there just weren't options available that their dentist maybe could provide. These people can come to one location and have all the treatment provided in one setting by one doctor, and they're happy. They feel confident and assured that they're going to be treated the way they want to be treated.
What do you like most about what you do? And we're out of time, but what do you like most?
I like the effect that it has on their lives, the personal stories they tell me later of how it's affected their family and friends and the end result. I enjoy the technical work, but it's the people and the stories they have to tell afterwards that make it worthwhile.
Okay, so somebody watching this, we're talking about full mouth reconstruction today, they're watching this, they haven't been to the dentist in 15, 18 years, and they have loose teeth, and they know their teeth have to go.
Yes.
What do you say to them?
Don't assume that you have to have a denture. Don't assume the worst, and certainly don't assume that it's the worst case ever. Well, this is the type of thing that I see all the time and that we treat on a regular basis, and there's more options than they probably think, and we can help them get the smile they want.
Good. Do people travel to see you sometimes?
I do. I get patients all
over Colorado?
All around Colorado. I get patients from Wyoming and from the far border of Colorado with Kansas even.
So your website has all of the information or some of this stuff?
Absolutely. Anything they need to find out about our practice and our availability is up on our website, advancedimplantsmiles.com.
Well, thank you for coming on. Very good. Very nice. Nice stuff. You've been watching The Wellness Herald, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you could visit our website at wellnesshour.com. Just put in Colorado full mouth reconstruction or just Colorado dentist. He'll show up as well. For now, I wish you could help.